Have you had a head injury, whether it's a car accident, a slip and fall and you bounced your head off of the pavement, or you were walking down the street and something fell off scaffolding and the next thing you knew is you woke up from being knocked out cold? We just had a patient come into our office about 6 weeks ago. She was in New Orleans and she was walking down the side street where there's some construction going on, and the next thing she knows is she wakes up on the ground in a puddle of blood. And unfortunately, there were no bystanders around, but some scaffolding, which was up for construction, had just simultaneously at the right time broke loose, fell down, weighed probably about 50 pounds. There was a bracket on it, hit her right in the back of the head, and she ended up with about 59 stitches. And this was about 6 months ago. Obviously suffered a concussion, severe cognitive problems, hyperacusis, sensitivity to noise, sensitivity to light. She wears 2 different glasses because lights cause so much trouble. She's had a constant headache since, severe cognitive problems. At work, people are like, what's wrong with you? You're not the same person, because she's not outgoing and bubbly anymore. And those of you who have suffered these kind of injuries know when you don't feel well and you're dealing with all these sorts of things, it's kind of hard to fake a smile. And the cognitive problems, of course, affect work, which she was having trouble with. Anyway, a patient of ours who did quite well under care is a coworker, sent her into the office, and we took the 3D imaging to look at the upper neck, most importantly, how this top vertebra right here called the atlas fits to the skull. And so when people have a concussion, no matter what the mechanism of injury is, it not only, if you have a force strong enough to shear brain tissue, simultaneously this 12-pound mass that sits on this 2-ounce bone, that force, that shearing force, dislodges that segment at the joint level, so that where the joint between the head and the neck meet, it misaligns, and if it gets locked there, it irritates the most important part of your body called the brainstem. And while over time the brain injury can heal, that structural problem persists. It continues to irritate the nervous system. It causes the muscles through the whole spine to become imbalanced, and it can cause a whole host of different problems. Now in this gal's case, in most of these concussion cases that are quite severe, they are not overnight fixes, and sometimes we have to bring in myofascial therapists and neuro-ophthalmologists and different healthcare providers to help them along. But one of the things that if you haven't done, if you've suffered an injury like this, you need to get yourself to an upper cervical chiropractor to get checked in the upper cervical spine, because if you had an injury like this gal did, almost guaranteed that segment is locked. And when you have irritation on the cord, it's decreasing your body's potential, and it just can't heal as well, and it will heal in the wrong direction. So by getting the segment fixed back in its normal range of motion and monitored over time, you're allowing the central nervous system to kind of restore normal function, bring the muscles back into balance, help the cognitive issues. And this gal is doing much, much better. We've gotten another coworker in because they've seen the change in her personality-wise. Headaches are improving, visual stuff is improving, sleep is improved. And so I make these videos to reach people out there that are dealing with things like this gal was and I did 30 years ago, because a lot of times we end up in the mainstream medical system, which is good at certain things, but they're not good at fixing structural problems from injuries. So hope this video has reached some people that are suffering, that are looking for alternatives to find ways to heal themselves.